Diseases of the pericardium and heart disease. For diseases of the pericardium, we have congenital pericardial diseases, pericardial effusion, and constrictive pericardial diseases. For the congenital pericardial diseases, we have pericardial cysts, partial defects, and peritino-pericardial diaphragmatic hernia. The treatments for all of these are surgery. For pericardial effusion, it's acquired. The definition is fluid in the pericardium, which causes cardiac compression. The causes in dogs are neoplasia and idiopathic, and in cats it can be congestive heart failure, FIP, and lymphoma. The signs are ascites, weak pulse, jugular distension, and muffled heart sounds. For the diagnosis, when listening we can hear fluid, and when doing an ECG we can see a low R wave, and in radiology we can see a rounded heart. For the treatment, we do pericardiocentesis and antibiotics if it's purulent, and anti-inflammatories. The prognosis is good if it's idiopathic, but if it's neoplastic, it's poor. For constrictive pericardial diseases, they're defined by pericardial scarring, which leads to impaired diastolic filling. The signs are right-sided congestive heart failure, such as ascites and hepatomegaly, and the treatment is a subtotal pericardectomy, and the prognosis is good unless the epicardium is involved. For heartworm disease, for the overview, the cause is Diphtheria immitis, which is spread by mosquitoes. The species it affects is dogs as the definite host, but it can also affect cats. And it can cause hard respiratory signs in cats. The severity is influenced by the number of worms, the immune response, and the duration, and the location of the worms. For the pathogenesis, adult worms can cause vascular trauma and pulmonary hypertension and congestive heart failure. Dead worms can cause embolization, and cable syndrome is when worms get into the right side of the heart and they cause acute congestive heart failure and hemoglobinuria. For the clinical signs, in dogs we can see a mild cough, and if it's severe we can see dyspnea, hepatomegaly, and congestive heart failure. And in cable syndrome we can see sudden death, lethargy, and congestive heart failure. In cats we can see asthma-like signs, dyspnea, and sudden death. For the diagnosis, we can do antigen tests in dogs and the modified NOT test for the microfilaria. And for the imaging, we can see pulmonary artery dilation and right ventricle enlargement. For the treatment in dogs, give melorazumine for the adults and treat congestive heart failure, furosemide, and give ACE inhibitors. And for cable syndrome, have surgical worm removal. Monthly prevention should be given with ivermectin and moxidectin.